How are you feeling?
I'm doing pretty well, thank you.
Good. So I have everything set up. Thank you for waiting patiently.
Sure.
We can go ahead and begin with your examination if that's okay. Perfect. So as I stated, we have you back in today for a follow-up examination. So I know it's been about a year since the last time I saw you, so
Yes.
you might be a little forgetful about everything that we went over, but I will
Okay.
be sure to go ahead and remind you of everything before we proceed with the different portions of the examination, okay?
All right.
So as always, if I can have you confirm your first and last name for me to get started.
Yes, James Monroe.
Perfect. And if I can just have you confirm your date of birth for me as well.
Yes, November 15th, 1994.
Perfect. Thank you very much.
Sure.
Are you okay to tell me the reason for your visit today?
Yes, there's a follow-up post-concussion. So I had a concussion about a year ago. So this is my second or third follow-up now after that happened.
Perfect. So it looks like you've been keeping up with your follow-up appointments, so
Yes.
that's amazing. Thank you very much. Okay. Okay. So essentially, just to give you a little bit of like a once-over of what we're going to be doing today.
Okay.
So this is a follow-up from your examination that we performed last year.
Mhm.
That was your initial, and then this is your annual. So
Okay.
basically what we're going to be doing is going over a couple different things. Some of the stuff was tested. Not as extensive, I would say, as your first examination, because you didn't say that you've been experiencing like an exacerbation of symptoms,
No.
but some lingering symptoms that you were having before.
Right.
Okay. All right, James. So essentially about a year ago, you were diagnosed with post-concussion syndrome. Now that's kind of a spectrum diagnosis. It's not the same for everyone. It's not
Okay.
definitive in that if you have this, then you have these symptoms.
Okay.
There really are grades and it's different for everyone, and it does fluctuate as far as timeline. So
Okay.
I would say after about the 1 year mark, so from here on, if you're still experiencing some of these symptoms, then we're kind of looking at what's called long concussion syndrome,
Mhm.
which means that it's just lasting for longer than what would be considered average.
Right.
Okay. Okay. So there are some things that we are a little bit concerned with since your last visit. You did say
Okay.
on your initial visit that you felt like you were having some issues with your short-term memory, some mild to moderate headaches, as well as screen and light sensitivity.
That is true, yes.
Okay. So do you feel like those are still kind of happening for you? Are you noticing any changes, either positive or negative?
In moderation, it's still happening.
Okay, so you are still experiencing.
Yes,
So memory loss, headaches, both screen and light sensitivity.
that's correct.
Okay. And you're still working from home?
Yes, I am.
Okay. So essentially today we're just going to be ruling out any further decline as well as evaluating your progress.
Okay.
So just seeing kind of where you are on the spectrum, how everything's going
Okay.
from a neurological standpoint.
All right.
So as previously discussed with any patient, so this isn't just specific to you, but I do just want to remind you, some of the things we're looking for aside from these specific symptoms are things like early onset Alzheimer's, symptoms of dementia, which can be related to the memory loss. Again, I'm not saying that that's specific to you, I just want to provide you with the information. We do also sometimes see symptoms that coincide with Parkinson's, secondary to the post-concussion syndrome, as well as CTE. So I'm not sure if you're familiar with that. It is something that's terminology that's commonly used in sports like football.
Correct.
So that's chronic traumatic encephalopathy.
Okay.
Sometimes repeated, but it can be singular, basically blows to the brain where your head has been moved in a way that's unnatural. So your brain is being moved within your cranial cavity in a way that causes trauma.
All right.
Okay. So just some things for you to know. Different symptoms that we're looking for kind of coincide with some of these things as well.
Okay.
Okay. All right, so if we can move on, I just have a very brief list of symptoms that I'd like to go over with you. If you're able to just let me know whether or not you're experiencing any of the following, as well as what grade. So for example, the first question is, are you experiencing any pain? So your current pain level as you sit here on a scale of 1 to 10, 1 being no pain, 10 being very severe pain.
Okay.
So what would you say your current pain level is?
Current pain level is just a 1.
A 1. So little to no pain.
Yes.
In the last 7 days, would you say that has fluctuated at all, or your baseline is little to no
It
pain?
has fluctuated, just maybe to a 3, possibly a 4.
Okay. And can you tell me where about that pain is located? Is that
It's like a headache pain. It's
Okay.
like front head
so
over
kind of
the
front
eyes.
temporal? Okay.
Yeah.
Okay. Is there anything that kind of coincides with that pain as far as time of day, activity?
Yes. It's usually towards the evening. It's usually after working, too much screen time.
Got it. Okay, so still that screen sensitivity.
It's still an issue, yes.
Now, are you taking anything for the headaches, like Tylenol, Aleve?
It hasn't gotten so
You don't
bad
feel
that
like
I
you
feel
need
like
to
I've
take
needed
it?
it, yeah.
Have you been experiencing any fatigue?
Possibly, yeah.
Okay.
I think so.
Occasionally?
Yes.
Okay. Any disturbances in your balance? Do you feel like you're off balance or like your equilibrium is off?
No, I don't.
Any difficulty concentrating on specific tasks?
No.
Now, I know you were experiencing some mild short-term memory loss. Is that something you still feel like you're dealing with? You kind of said maybe a possibility.
It's minor.
Very minor.
Yeah.
Do you feel like it's improved?
I think it's the same.
Stayed the same?
Yes.
Okay. Any dizziness?
No.
Insomnia or trouble sleeping?
Yes, potentially.
Frequently?
No, once a week.
Okay. On the days that you feel fatigue, does it correspond with the nights that you're unable to sleep, or is it kind of sporadic?
It does correspond
does.
with those nights.
So
yes.
the nights that you have trouble sleeping
Yes.
during the day is when you feel fatigued.
That's correct, yes.
Okay. Any irritability?
I don't think so.
You did say you were still having some of the sensitivity to light.
Yes.
Okay. All right. Any sensitivity to noises?
No.
No. Do you feel like you have brain fog?
No, I don't.
No. Okay. Any anxiety?
No.
Vision loss?
No.
Any blurry vision or disturbances in your vision, such as floaters or what people describe as like orbs of light,
No, I don't think so.
double vision?
No.
Okay.
None that I can recall.
Okay. And then the last two questions are related to your hearing.
Mm-hmm.
So are you experiencing or have you previously experienced any hearing loss?
Not loss, but well, I guess yes. Then the answer is
Okay.
yeah.
And this is secondary to that concussion?
Yes, it is.
Okay. Is this recent? I don't remember you describing this in your last visit.
Yeah, just I have to say, excuse me, would you say,
Okay.
more often than I think I should.
Okay. With that, have you seen or noticed any abnormal earwax or discharge from your ears?
No.
Nothing like that?
Nothing like that.
Okay. Any ringing of the ears or what's known as tinnitus?
No, nothing like that either.
Okay. And no like whooshing sounds?
Mm.
Okay. Very good. So the hearing loss is something that we will come back to. I'll have a quick peek in your ears and see if that's maybe just some like accumulated earwax or if that's something that's happening maybe neurologically that we need to look into further, okay?
Okay.
Perfect, okay. All right, James, so we're gonna go ahead and move on. And this portion of the examination is going to be your mental evaluation.
Okay.
So as we did last year, I'm going to be starting with a very basic orientation evaluation. So basically assessing your ability to say who you are, where you are, that kind of thing, okay? So
Sure.
just basically that you're of sound mind and that you're able to complete the rest of the examination appropriately.
All
Okay. So can you tell me if we are currently inside or outside?
right. We're inside.
And whereabouts are we?
Doctor's office.
Can you tell me how you got here?
Yes, I drove.
Good. And are you able to name Anything that you've seen in the news recently, current event, anything that's going on in the world?
There's no Charlie's coming for downtown.
I did see that as well. Very cool. Okay. Alright, so moving on to portion 5 of our examination. Now this portion is similar to the last, just slightly more in depth.
Okay.
I'm going to be testing your cognitive awareness as well as your memory.
All right.
So since you said you were having some issues with your memory, we'll ask you a couple questions and see how you do.
All right.
No pressure if you get anything wrong.
Okay.
Okay? It's just an assessment. It's not necessarily pass or fail. It's just to kind of see how you're doing.
Okay.
Okay? So the first thing I'm going to have you do is repeat a series of words after me. Table, tablet, talcum, tundra.
Table, tablet, talcum, tundra.
Very good. Now I'm going to have you repeat a series of numbers.
Okay.
57, 86, 97,
57, 86, 97,
3, 22, 61.
3, 22, 61,
Good. 57, 86, 97, 3, 22, 61.
57, 86, 97, 3, 22, 51.
Very close. The last number was 61.
Oh,
That's okay. Can I have you verbalize the first 7 letters of the alphabet?
yes. A, B, C, D, E, F, G.
Very good. So I'm going to have you solve a series of equations just out loud. 51 plus 9.
51 plus 9 is 60.
Good. 9 plus 30.
39.
30 plus 51.
81.
Very good. Just no issues there. Okay. So the following question is going to be a scenario. So I'm going to give you the scenario and then I'd like you to solve the equation if you can, okay?
Okay.
So I'd like you to picture a dining table. The dining table has 8 chairs. 3 people are seated. 1 chair is broken and there's a cat sitting in another chair. How many chairs are then available?
4 chairs.
Very good. So no issues with that. You answered it right away. Now I'm going to show you 3 different objects.
Okay.
And I'd like you to tell me which is the 3-dimensional, which is the 2-dimensional, and which is the 1-dimensional just by pointing to them, okay?
Okay.
So here are the objects. So can you point to the 2-dimensional object for me?
Yes, the one in the middle.
Good. And the 1-dimensional?
The first one.
Good. And then of course the 3-dimensional.
The third one.
And can you tell me what these are? So what is this?
A line.
And this?
A rectangle.
And this?
A cube.
Very good. So no issues with that. You did really well. Okay, so moving on. Doing okay so far?
Yes.
All right, so we're going to be assessing your executive function as well as your visual spatial function. So that's a lot of convoluted words that essentially means I'm testing your brain's ability to work in conjunction with your body. So how you process thoughts and movement, are you able to do that in a fluid motion without rigidity? So
Okay.
you should be able to say, I want to pick up the pencil and pick it up immediately without any issues.
Okay.
So can you demonstrate to me how you would answer a phone? So the phone is ringing, how would you then answer it?
Hello.
Very good. And if you were wearing a wristwatch, how would you check the time?
Like this.
Very good. If I handed you a knife and asked you to cut a series of vegetables, can you demonstrate to me how you would do that?
Sure, I will hold the knife in my hand like this. I would.
Very good. So I am going to hand you a stack of small cups. I'd like you to stack them in 2 even stacks if possible.
Okay.
So whatever way you need to devise that, you can go ahead.
I think that's even.
Okay. you tell me how many cups are in each stack?
Can I count them?
Absolutely.
10 in each stack.
Okay. Very good. So there were 20 cups to start with.
Yes.
So you did very well there. Okay. So I am going to hand you 3 puzzle pieces. I'd like you to put them together for me, okay?
Okay.
Very good. No issues there. This is a fairly small puzzle. It is from a 1,000-piece puzzle, so it is quite difficult, and you did very well.
Okay.
Okay. So I'd like you to identify a few colors for me. Can you tell me what color this is?
Yes, pink.
Good. And what color is this?
Red.
And this.
Mint. Green.
Perfect. And what color is this?
Darker emerald green or forest green.
Very good. Okay. I'd say it's a hunter green, but I guess that's up for debate. You did very well.
A Kelly green, possibly.
Kelly green, you are correct. Because hunter green is just slightly darker. Okay, so I am going to show you some cards with words. And essentially this is a test to determine your ability to concentrate on things, given that there's a direct distraction, okay? So what I'd like you to do is take this for me, and I want you to read starting here. So you're gonna read every line as I distract you in various ways, okay? So you just continue reading as I go on about distracting you.
Sure.
Okay.
You know how. Down to earth. I got home from work. Near the table in the dining room, they heard him speak on the radio last night.
Very good. So no issues there. You were able to read it pretty quickly. And even with distraction, you were able to pay attention. So that is very good. Even I struggle with that sometimes. So give me just a second here. I'm just going to catch up on a couple of notes and then we can proceed. Are you doing okay?
Yeah, I'm doing fine.
Okay. So we're going to move on to the physical portion of the examination today, okay? So it's going to be a series of things. I don't want to call it a cranial nerve exam because we aren't doing the full order of cranial nerves, but I will be testing them sporadically. Again, not as in-depth as your first examination, but I do want to make sure that things are functioning properly, okay?
Sure.
So we're going to start with the pen light, and I'm just going to put a pair of gloves on here. Now I will be coming fairly close to you, touching your face, and that kind of thing, okay? So I just want to give you a little bit of a warning.
Sure.
All right, James, so if I could have you just turn slightly and then come just a little bit closer to me here. Perfect, okay. So let's go ahead and get started, and I believe my pen light is hiding here. So you are welcome to leave your glasses on if you'd like. You can take them off. I will have you take them off in a few minutes if you'd like to leave them on for now.
I'll leave them on for now.
All right, so I'm going to begin by shining my pen light in your eyes. The first part of the examination, I'm just testing your pupillary reaction. So testing how fast and whether or not your pupils constrict and dilate consecutively or not, okay?
All right.
So coming in a little close here, I'd like you to just keep your eyes open for me, and then if I can just have you tilt your head slightly this way. Perfect. So So I know you were having that light sensitivity, so if it becomes extremely uncomfortable or starts to give you a headache, I would like you to let me know and we can give you a break, okay?
Sure.
So far, I'm getting very good reactivity in your eyes. So your pupils are constricting and dilating appropriately as far as I can tell. Very good. So I'm just going to swing my light back and forth rather quickly. And if I just slowly bring my light in here. Very good. You doing okay?
Yes.
I'm going to hold this card up
Okay.
on either side, and essentially I'm just occluding your vision.
Okay.
Good. Very good. Okay. So no issues with that. So I think what I'm going to do next is just have a brief look inside your eyes with my ophthalmoscope. So I'm sure you remember this device from last year.
Mm-hmm.
Essentially just going to allow me to have an up close look in your eye, okay?
Okay.
So if I can have you open wide for me. Good, and then if you can turn your head towards me just slightly. And open wide, perfect. Can you look up for me? Good. And I'm gonna have you look down. You look to the left and to the right and to the left. Very good. Okay. So no signs of abnormal discoloration or anything there. Very good news. Okay. So moving on to our next test. I'm going to do what's called a follow the light examination.
Okay.
So I have a different light here. This one's not nearly as bright. I'm going to have you follow it. So I want you to keep your head still for me at about
Sure.
this position.
All right.
Follow the light if you can with just your eyes, okay?
Yes.
Very good. Any blurry vision or double vision here?
No, there isn't.
Are you seeing more than one light?
No, just one.
Very good. Good. Okay, very good job there. Okay. So what I'm going to do now is a test for a couple different things. So testing for color blindness as well as testing your peripheral vision and your blind spot. Okay?
Okay.
So peripheral vision is just vision you can see on the sides of your eyes while you're looking forward.
Right.
Color vision obviously is your ability to see colors. I don't think you're colorblind. You were able to identify the colors earlier, but I'll be
Right.
switching them in and out and asking you whether or not you can see them.
Okay.
Testing your blind spot. So there are certain blind spots that everyone has. So if I hold up a figure and move it around your visual fields, there are certain spots where you should not be able to see it, and
Right.
that is a normal reaction, okay?
Okay.
Okay. So to start, I'm going to have you hold this up. And this is an ocular occluder, so essentially it's just going to occlude or block one side of your vision. So I'll let
Okay.
you decide which side you would like to block first. We will
Okay.
be testing both sides.
Okay.
Perfect. So I'm going to have you just turn your head here for me.
Mm-hmm.
Now, can you tell me if you can see this here?
Yes, I can.
What color is it?
It's red.
Very good. So I'd like you to keep your head still and follow it with your eyes.
Okay.
Just tell me when you can and can no longer see it. So for example, you should be able to see it here,
Yes.
and at some point it should disappear.
It disappeared.
Okay, so just disappears and reappears, okay?
Sure. Disappears. Reappears. Disappears. Reappears. Disappears. Reappears. Disappears. Disappears. Reappears. Disappears. Disappears. Reappears.
Now, can you tell me when you can no longer see
Right
it?
there.
And on this side,
Right there.
and top,
Right there.
and bottom.
Right there.
Perfect. Can you switch eyes for me?
Sure.
Can you see this okay?
Yes, I
Can
can.
you tell me what color that is?
Green.
Perfect. So same thing.
Okay. Disappears. Reappears. Disappears. Reappears. Disappears. Reappears. Disappears.
Good. Can you tell me
Reappears.
when it disappears here?
Disappear. Reappear.
And
Disappear.
And up
Disappear.
and
Reappear.
down.
Disappear.
Good. I will take that from you. Okay, now something similar, except this time I'm going to hold two of them. And I'd like you to tell me when you can see both of them at the same time.
Okay.
So can you see them here?
No. Yes. No. Yes. No. Yes. No.
Can you see them
Yes, I
here?
can. No. Yes. No. Yes.
Focus on this one for me.
Mm-hmm.
Look at the pink. Good. The green. Pink. Pink. Green. Pink. Green. Both. Okay, very good. Just testing your preferences there. It did seem for 1 second that you were able to see a little bit more on this side,
Okay.
but it might just be that you're more dominant on this side. I didn't notice any
Okay.
really big discrepancies. Okay,
Sure.
very good. Okay. I would say your color vision as well as your blind spot test was within normal limits.
Okay.
So we're gonna move on, and before we move on to the lower kind of chest body portion of the examination, I am going to test your ocular reflexes. So for this test, I am going to have you remove your glasses just temporarily,
Okay.
and I'm going to be touching around your eyes, okay?
Okay.
So I'm sure you remember this test from last year. Essentially, I'm going to have you just allow your eyes to react naturally. It is going to make you blink, and that is essentially what I'm looking for, okay?
All right.
So I'd like you to just look forward here for me.
Okay.
Perfect. Can I have you close your eyes for me for just a second? Okay, so you can go ahead and open. I'm going to do that one more time, just very briefly, in the corner of your eye.
Okay.
So I'm going to induce a very light puff of air, and it should make you blink. So, very good. Okay, give you just a second. I know that's a little uncomfortable. You're doing really well. Would you like a tissue?
No, I think I'm okay.
I'm going to go ahead and move on if that's okay with you.
Sure.
So the next set of tests we're going to perform is called the Romberg test. Now, last year when we performed this examination, I had you stand. Because you're not really having any physical deficits, I'm not going to have you stand today, but I will have you perform the test the same, okay?
Sure.
So you can go ahead and put your glasses back on.
All right.
Okay. So what I'm going to have you do is cross your arms over your chest for me. Good. And just keep your eyes open. I want you to stay like that for just a second.
Okay.
Just looking at your overall posture as well as your ability to remain upright and still. So looking for any swing. Okay. So now I'm going to have you close your eyes and keep them closed for me. Good. So I'm not noticing any drift. You can go ahead and open. Can I have you put your hands straight out for me? Good. And keep them out. And close your eyes for me. So you're going to feel me touch you. Keep your eyes closed. Okay, I'm going to tilt your palms up, arms straight out. You're going to feel me touch you. Very good. Okay, you can go ahead and relax. Just making sure your balance is intact there, okay? So you did very well. So what I'm going to do now is have my finger here. I'd like you to touch your nose with your index finger and then touch my finger with your index finger.
Okay.
So you're going to touch your nose, touch my finger, touch your nose, touch my finger, and I will be moving my finger around, okay?
Okay. Using the same finger?
Yes.
Okay.
So we're going to start here. So go ahead and touch your nose. There you go. Again. Good. Faster. Good. Other hand. Very good. Okay, so no issues there. Okay. So I'm going to do a little bit of a pressure test. So essentially what that means is I'm going to apply a certain amount of pressure.
Okay.
One will be softer, one will be harder.
Okay.
So if I can have your hand, just to give you an example. So if I were to say this is 1 and this is 2, can you tell me which one was firmer pressure?
2.
Good. So I'll be performing that examination on your face.
Okay.
So you can keep your eyes open or close them, it doesn't matter. I'd like you to just tell me which one is firmer. Okay? So 1 or 2.
1.
Good. 1 or 2.
2.
Good. 1 or 2.
1,
1 or 2.
2,
1 or 2.
1,
1 or 2.
2,
1 or 2.
2,
1 or 2.
2,
1 or 2.
2,
1 or 2.
1.
Very good. Now I'm going to touch you on either side of your face. I want you to just let me know if it feels the same on both sides, okay?
Sure.
So, does this feel the same?
Yes, it does.
And this feels the same?
Yes.
Does this feel the same?
Yes.
Does this feel the same?
Yes. 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 Yes.
Good. So no differences on either side there.
No.
So what I'm going to do now is another one of those distraction tests. Okay,
Okay.
so kind of like a trick question. This one's going to be a little more difficult. So I'm going to apply this distraction stimuli to you. So essentially you're going to feel a vibration on one part of your face and something else on another part of your face.
Okay.
So what I'm testing is your brain's ability to feel more than one thing at the same time.
Sure.
So I'm just going to give you an example. So if I touch you here with this, and then here with this, not very difficult to tell that they're two different sensations. But if I touch you here with this, and here with this,
Can't feel
it's a lot more difficult to tell. So that's basically what we're testing. So any person with what's considered normal neurological function will have difficulty feeling this.
Okay.
But as I move away, you should be able to feel that there are two different stimuli here, okay? So I'm just going to test this on your face.
Okay.
So if I can have you close your eyes for me. So essentially what I want you to do is just say yes when you feel this, okay?
Okay. Yes. 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 Yes.
Very good.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, very good. So you were able to feel within an inch distance, which is
Okay.
what we would say is about normal.
Okay.
Okay? So you did very good with that. So moving on, I am going to have you stick your hands out for me, so palms up. I'd like you to just look directly at my nose. Don't pay any attention to what I'm doing here, okay?
All right.
Very good. Same thing, just look at me. Very good. Okay, so you did really well with that. We are almost done with your examination, James. Last thing we are going to test is just a couple of reflexes in your upper extremities as well as in your face.
Okay.
Nothing too in-depth, just testing for motor function.
Okay.
So what we're gonna do is have you close your eyes really tight, and I want you to not let me open them. So don't let me open, close tight. There you go. Good. This side. Good. Close your mouth tight. Don't let me open. Good. Can you turn your head into my hand here? And don't let me push it back. Same thing on this side. Good. And down. Back. Very good. Okay. So testing some strength in your upper extremities. Can I have you hold your arms just like this? Don't let me pull towards me.
Okay.
Don't let me push towards you. And with just your wrists, don't let me pull and don't let me push. Good. Fingers out for me. Don't let me close them together.
Okay.
Very good. And if you can close them real tight and don't let me open. Good. Now I'm going to place this in between my index and ring finger. I'd like you to do the same on this hand. And don't let me take it away from you. Good. I'm going to switch to my pinky. Very good. And on this side, so starting with your index, good. Good. And your pinky. Okay, so a little bit of weakness on this side. So I'm going to try that with this hand. Okay. Are you right-handed?
Yes.
Can I have you squeeze my hands? So both hands. Squeeze, squeeze, squeeze. Hard. Good. Curl your pinkies for me. Okay, so very, very mild loss of muscle tone on this side. Is that something that you noticed before?
No, it's not.
Okay. I did not note that on your last examination, so I don't suspect that is related to this, but I will go ahead and document that, okay?
Okay.
Alrighty, so the very last thing I'm going to do is test your jaw reflex. After that, we will be all done with your examination.
Okay.
So if I can just have you hang your jaw open for me and just relax. And one more time. Very good. Okay. All right, James. So I would say that as far as your annual examination is concerned, there is not many changes from your initial exam.
Okay.
So that's good news, really, because we don't want to see a decline. We
Right.
definitely don't want to see an emphasis in your symptoms. We don't want to see that you're having any more memory loss than you were before,
Right.
or that you're having any kind of cognitive decline, that your neurological function have worsened.
Yeah.
So there are no changes. I don't see any improvement necessarily, but that's okay. So we're only about a year out.
Okay.
I would like to test you again, this time in 6 months.
Okay.
So the reason I'd like to test you sooner is because I want to see if you are progressing at all, or if we're looking at more long-term concussion syndrome.
Right.
Okay.
Yeah.
So I'd say about 6 months is probably a good gauge.
Okay.
If you notice that any of your symptoms start to exacerbate, I would like you to call me, and then we can schedule an appointment sooner.
Sure.
Okay?
Yep.
Do you have any questions for me before you go?
No, I don't think so.
Okay. Well, we're all done. I will update
Okay.
your chart, and I will send that over to your regular physician so that we can kind of coordinate notes there, okay?
All right. Thank you so much.
Thank you very much, James. I hope you have a good evening.
All right. You too.
Get home safe.
Thank you.